Okay, so I'm going to start by confirming the doctor's orders, ensuring that they actually do need a venipuncture and a venous blood draw. After I ensure that the orders are confirmed, then I'll perform hand hygiene. I'll introduce myself to the patient, identify the patient, scan their armband and their specimen, and then I will move on to setting up for a venipuncture. Okay, so I have all my stuff out. I'll go ahead and put on my gloves. I'm going to apply a tourniquet, and I can only have this on for 2 minutes. So I'm gonna have to move fast after I get this applied. Alrighty, so now I'm just going to give them a second. If it was a normal human being, I could have them squeeze to get their veins full. And then I'm just gonna palpate for a nice bouncy vein. So I can see a couple here, but I think this one feels the best. So I'm gonna go ahead and clean the area. And then while that's drying, I'm going to go ahead and get my supplies put together. So go ahead and twist this open. Go ahead and put on my Vacutainer. And then I can have this in here, but I'm not going to puncture the vacuum seal yet. So now I'm going to go ahead, this is dry. I'm going to go bevel side down. Gonna get where I can see well, flush with the skin. And on this needle, I'm not gonna get any flash. So I'll go ahead and then I can switch into another one if they have enough blood for that. And then I would use a piece of gauze to cover the needle and gently pull it out and retract it. Discard it in a sharps container, and then I would apply pressure for 2 to 3 minutes on the site that I poked, and then after the bleeding stops, I will wrap it in gauze. The specimen needs to be labeled with their information, and it should be immediately put into a sealed biohazard bag and taken down to the lab. We're going to work on hanging IV fluids. You would only need to do this if your patient needs an IV. So if your patient does need an IV, you're going to double check the fluids that you're going to be administering through the IV. And so I'll get my fluids, I will check the expiration date and scan it in if I need to. And I'm going to go ahead and turn this guy upside down so I don't spill it. And then what we're going to do is we're going to attach the IV tubing, and it's going to be pretty quick because this needs to be sterile. So I'm going to remove this and then remove this and stick that guy in there really quick. Alright, so he's in there, and then I will go ahead, flip it over, clamp it, hang my bag on my stand. Now I'll go ahead and unclamp it. I'm gonna squeeze some fluid in here too. That was way too much. Wow. Usually you want this to be about halfway so that you can see the drips. So this is primed because it's dripping out. So then I'll just clamp it, and then this is ready for when I need to attach it to my patient's IV. So I attached it. I should have filled this halfway so I could see the drips, and then I prime it so that we don't put any air in my patient's IV. So now we're going to be starting an IV, and before I start an IV, again, I'm going to confirm the doctor's orders, make sure they need an IV, identify my patient, introduce myself, perform hand hygiene, and I'm really going to take steps to make my patient comfortable for this procedure. IVs can be really uncomfortable for a lot of people. A lot of people really don't like needles, so I'm going to do what I can to make them comfortable. Explain the procedure in detail, let them know what's going to happen. So I'll go ahead and start by placing my items that I need, getting them out, getting my field ready. I placed something under my patient's arm just in case we make a mess. And now I'm going to go ahead and put on my gloves. Oh, you know what else I didn't do? I didn't clean it.
Actually, first I'm going to gather my supplies and supplement.
You can still do that.
Huh?
You can still do that.
Oh, I'm going to. Okay. I was just saying in my last video, I think. We can use this part or not. Hi, Taylor. Anyway, so now I'm going to attach my J-tubing to my flush. So I'll pop this cap off, take this cap off. I won't take that cap off because we're not ready for that yet. Take this cap off, go ahead and screw it on there. So now this is ready for when we have the IV inserted. And then I am going to, so now we're going to need to move pretty fast once I get the tourniquet on because we only have about 2 minutes. So I'm going to tie the tourniquet. And then I'll have him squeeze a few times so I can visualize the vein. And then I can also check the radial pulse. That was the ulnar pulse. I can check the radial pulse to ensure that we're still getting circulation. Then I will crack this, shake it, and clean the spot. This has already been used, so it's not going to look like I'm putting anything on there, but I am. So then I would have cleaned about the space that the bandage is going to cover. And then I'm going to discard this, and I'm not going to touch that space anymore. Then I'm going to quickly open my needle, and this is going to be drying while I do this. It needs to dry for at least 60 seconds. Alrighty. So now I'm going to anchor the vein. I'm going to go bevel down and all right, so we got some flash, so I'm going to go ahead and have this flash and I pop my tourniquet. So now I'm going to retract my needle and pull this out. And then we're going to move really fast. I pulled this cap off. Get that on there. And then we're going to go ahead and then we're also going to come back and see if we get some blood back. We'll push that in. Good. So we can go ahead and flush that. And then I can, so now I'm going to go ahead and apply my bandage for my patient. I'm going to have them go ahead and sit really still for me. I'm going to go ahead and seal these edges down. Just making sure it's really attached, and then I can go ahead and take this sticker off, or I can write on it with a marker with my initials, the date that I put it on, and the gauge that the IV is. And then I can also add a piece of tape right here just to make sure that everything is secure. And then now I'm going to go ahead and attach them to the IV now, since their IV is nice and stable. So we have this, I'll go ahead and take off the cap and then make sure that it's clamped. And then I can go ahead and just twist it on. And then if it was on the machine, I would make sure that everything was programmed into the machine the way that it needed to be with the drips and everything. Or I can just go ahead and unclamp this so that they can actually get what they need.